Okay, hello everyone. This is me, Samantha Harris, and I did my fact sheet on congestive heart failure. So, what is it? Congestive heart failure is a condition where the heart muscle does not pump blood effectively. So, we see a lot of decrease or increase of blood flow. There are 4 types. The first would be left-sided heart failure, which this causes fluid to accumulate in the lungs and causes shortness of breath. I have personal experience with this because my father was diagnosed with congestive heart failure in 2011 and had to go through a quadruple bypass in which they took veins out of his legs and replaced it up top because his major artery was clogged. And he had fluid in his lungs that would often cause his eyes to turn a yellow color, the whites of his eyes. There's also right-sided heart failure, which fluid builds up in the abdomen, which can cause swelling in the legs and feet. We see a lot of swelling issues because it's a circulatory problem that can be caused through the blood flow. And there's also systolic heart failure, and this is where the left ventricle cannot contract. And we have diastolic heart failure, which the left ventricle cannot relax. So question 1, systolic heart disease involves fluid accumulating in the lungs. True or false? The answer is true. So right here, I decided to add a little picture that I had on my fact sheet, and this is a picture of what diastolic and systolic would look like. So as I said, diastolic, it cannot relax. So as you can see, these are very thick walls, and they are not supposed to be that thick at all. And also in here, you can see that it's very thick as well, and it's not going to be able to fill properly. And then this right here, systolic, is where it cannot pump, it's not able to contract. So we can see that everything is very thin and stretched and a lot bigger than it's supposed to be, and it causes the heart not able to pump everything out because it's not able to constrict. So some signs and symptoms of congestive heart failure would be chest pain, which is described as a sharp, dull pressure, heaviness, or squeezing. My dad, when he had his heart attack, he was throwing up, he was sweating, he was going into cardiac arrest. He complained a lot of chest pain, and you see chest pain more commonly in people with diabetes because people with diabetes are not able to really register that they're having a heart attack because it really just feels like chest pain to them. There's also coughing and wheezing, swelling of the abdomen, ankles, and feet. As we said, we saw that with right-sided heart failure. Then we have irregular heartbeat, and this occurs when electrical impulses that coordinate the heart don't work properly, so your heart's going to be a little bit off, or it's going to have an extra. There's fatigue, weakness, and low alertness. Weight gain from fluid retention. This is kind of obvious with the weight gain because you can tell how it looks. It looks a lot more like they're bloated than just regular fat gain. There's shortness of breath because, the fluid can enter the lungs. Frequent urination 8 or more times a day or more than once at night. So we see elderly populations, they would more likely have frequent urination. So they would want to go see a doctor and be checked out, go through screenings to see if they're at any danger or if they have congestive heart failure. And then also a lack of appetite or nausea. So question 2, all of the following are types of heart failure except right-sided, diastolic, left-sided, or ventricular. The answer is ventricular. Here's another image that I decided to add. This is about what a normal heart looks like, and with congestive heart failure, it can be enlarged, as we can see right here, and we can see that it's slightly bigger than the normal heart, which is not healthy because that's going to start putting strain on your heart. So some ways that you can diagnose this is through a blood test, and this blood test simply looks for signs that the disease can affect your heart. There's chest x-rays, which would look for the fluid in the lungs, and an electrocardiogram. A stress test, which will show whether your heart responds normally to stress or exercise. A lot of corporations tend to put employees through this whenever they're changing from a shift position or changing to a higher position, any of those. There's also an MRI, which tests tissue damage, or looks at tissue damage from a heart attack and reduced blood flow in the MRI, or in the heart muscle. Whoops. And a CT scan will look for calcium score. And then there's also the myocardial biopsy, which is a small catheter grasping device on the end to obtain a small piece of the heart tissue. My father had a chest x-ray, a blood test, an MRI, and a myocardial biopsy done all the same night on July 3rd, 2011, when he had his major heart attack. So what does a CT scan for congestive heart failure look for? A, muscle tissue, B, calcium score, C, fluid in the lungs, or D, reduced blood flow? The answer is B, a calcium score. So some treatment and prevention. Treatments are going to be right here on this left side where we see physical activity. This would be moderate level. No smoking and no alcohol. So if you have this disease, you need to refrain from these. There's medications that will help, like aspirins and many others. Surgery, like bypasses, heart transplants. Fluid restrictions, such as reducing the amount of soda you drink or even the amount of water you drink. It's said to cut back from 6 cups a day. Restrict sodium, and like I said, heart transplant. Preventions is no smoking. That comes with any chronic illness. Physical activity, healthy diet, and maintaining a healthy weight. It suggested a BMI between 18.5 and 24.9, which we know is a normal weight, but you can be considered overweight or obese if you go over these. It's not necessarily the best tool, but it is something that is used to measure. Reduce your stress, limit or eliminate alcohol. So the difference between this as a prevention method and this as a treatment method is that the prevention is somebody that is going to be at more risk. So someone like me, my father has heart failure, so it would be smart for me to refrain from drinking a lot of alcohol or to just keep alcohol out of my system. And also getting an adequate amount of sleep, so about 7 to 9 hours for adults. Varies between all different ages, but this is what is suggested. Some unchangeable risk factors are age. So age, you can't change your age, gender, race and ethnicity, and then family history. Like I said, my father's mother runs in the family kind of thing. So it's something that needs to be looked out for, just like as if you were to look out for a stroke. Question 4. All of the following are prevention methods except A, surgery, B, physical activity, C, no smoking, and D, eliminate alcohol. The answer is A, surgery. So, some complementary therapies. I know this looks kind of messy and jumbled, but I'm going to start over here on the left. We have the biological ones. I have 3, which aromatherapy. This uses a natural plant extract to promote health and well-being. So we see this growing in popularity, not only with people that are trying to get over a chronic illness, but just as something to have in their house. They'll have little oil diffusers or incense or candles, something that can kind of put a positivity into the room and promote healthier well-being. Chelation therapy is a treatment that uses medicine to remove metals that make you sick. So this way it prevents you from getting sick or feeling low. A diet-based therapy, which is just modification of an existing dietary lifestyle to promote optimum health. So like my father used to go fast food every single day, and now he is a lot more strict on how many veggies he's eating, the grains, carbs, everything. He stays a lot away from sugars. All of this had to be modified once he found out of his condition. So some mind and body, these are, connection between mind and body. So yoga is a great one because this is not only just something that is going to help with the mind, but it's also a type of exercise, and it's going to help get the blood flowing, circulation moving, and it's going to help with reducing your stress, calming your mind, and stretching out all of those aches and pains that you may be feeling. And then also meditation, which is going to be a stress reliever. We also have manipulative and body-based therapies. Acupressure is one of them. And basically, once they put the needle in there, it sends a signal to the body to activate some self-healing. There's chiropractic manipulation, which just adjusts or corrects alignment. So they're going to like move your back or your neck or your shoulders. And then reflexology, which is an application of pressure on the feet. And as we know, there's a lot of nerve endings in the feet, so this can be extremely helpful. Question 5. Aromatherapy is A. Sends a message to the body to activate self-healing. B. Medicine to remove the metals so they don't make us sick. C. Natural plant extracts to promote health and well-being. Or D. Modification of an existing dietary lifestyle. The answer is C. A natural plant extracts to promote health and well-being. So a prognosis, cumulative observed risk of readmission for heart failure was 23% after 1 year, and 22% of patients deceased within 5 years of readmission. Now, once my dad was diagnosed with this, we did not know really what this meant until after his surgery, and he started getting really into his appointments. But he was told that he really needed to make a difference, because if his heart is not working properly, then he does not have a chance. So some resources to find out some more help, find out some more information or get some help is heartfailureMatters.org, mendedhearts.org, and secondscount.org. And then what I learned from this, I did not know that congestive heart failure had different types. So through this, I was able to learn the different types and even help my dad figure out which type of heart failure he had, because he didn't know before, and he probably just wasn't paying attention to his doctor when they told him. But through this, we were able to find out which one he suffers from. And after this fact sheet, we were able to find a better diet and exercise plan for him. And these are my references.